Jeff Worster, this is
Doctor, you're a sick person. And you are a loved one.
Actually, manager, we've been together for 7 years.
So what's the drug du jour on the bike circuit these days? Still erythropoietin? Or are you guys just chugging battery acid?
There's no way I'd touch EPO. Too many guys stroking out and dying.
Damn! $10 for the ticket, 6 for the popcorn.
I do straight blood doping.
Plot twist.
That's a very daring confession.
We've got confidentiality, right?
Assuming I'm more ethical than your client. So injecting yourself with donor red blood cells for fun and profit. Any other tricks up your sleeve?
Well, nothing much recently. I'm in town for a charity ride, so it didn't matter if I won. The kids just needed to see me.
If you go slower, they see you longer. Let's say that our health could be affected by things we did before last Friday.
Well, I usually sleep in a hyperbaric chamber. I've been pumping up electrolytes with an IV drip, anabolic herbal supplements, amphetamines, and diuretics.
Yeah. But why would you be sick?
I know that doping has risks. I know that it's outside the rules. But I do what I have to kick ass at my job. Don't you?
Dr. House is a firm believer in good old-fashioned hard work.
Every time an athlete goes down, you guys assume it's drugs. Look, the doctors say it's probably acid reflux. Yeah, look, call me tomorrow. There's a good chance he'll be released. Okay, bye-bye. So is this fixing him?
If his acid reflux isn't worse than we thought, yeah.
I gotta be in Spain in 4 days.
Shouldn't be a problem.
Great.
If I can just find the little bugger, should be able to suck it out.
My legs feel weak.
You're under mild sedation for the test. It'll wear off. There it is. Got it.
You're fantastic. I'll pack his things.
Not yet. I want to monitor him for a couple of hours, make sure he's okay. Give him time to sign a picture for me, maybe even a jersey.
To Dr. Chase, I owe you everything.
It doesn't have to be that personal.
Not too many eBay shoppers named Dr. Chase, huh?
Still trying to unload the Barbara Walters spit cup.
Here you go.
Seriously, anything's fine.
Jeff?
You all right? Jeff, can you swallow? Your anemia is caused by pure red cell aplasia. This is gonna hurt, but we gotta talk.
What the hell are you doing?
You'll be fine. Sort of. Just don't have time to watch him write out answers. PRCA comes in 2 varieties, chronic and acute. Since it came on fast, you have the acute version.
He doesn't have cancer.
Is the good news. The bad news is, pants are on fire. Acute PRCA is caused by drugs, most commonly EPO. Ready and action.
I haven't used EPO.
Okay, but this time with more anger. Remember, this guy's accusing you of cheating.
I haven't used that stuff.
Oh, mwah. I believed it. Simple, it was pure. Did you believe it? I guess it's silly to cast someone after the first audition. Why don't you do a reading?
Read that. He doesn't do EPO.
What did you think? It's a different way to go, but I don't know, I just didn't buy it. Did she handle any of your injections?
You think I'm giving it to him? Test him.
Gee, that's a great idea. I sure hope that EPO is not one of those drugs that's undetectable after 6 hours. Hey, you know what we can test for? Phone calls. Take her cell phone, push the redial button. Even Money says you'll be connected to the newspaper that leaked your cancer story. Okay?
Okay, I should have told you. It's not just about the races, Jeff. It's about your image, okay? If you come back from cancer, those sponsors will be all over you. Okay, so I messed up, okay? But I did not give you EPO.
That stuff could kill me.
Come on, give her a break. She's only doing what she has to do to advance her career. Don't you have that tattooed on your tushy?
I would never do anything to hurt you.
Who are you gonna believe? The manager you trusted for years? I've been to college.
fired.
Okay. You're basing this whole diagnosis, everything, on the idea that I was slipping him illegal drugs. You're gonna kill him.
If Dr. House is so sure, why do you need to stay?
He's a very cautious man. Your breathing's better. Let the prednisone do its job. Get some sleep. Jeff? His red blood cell count plummeted to 16%. He passed out, had to be resuscitated, and he still can't move his legs.
It's not possible. The drugs should be flushing out of his system.
Can't leave if they don't exist.
The EPO use explains every one of his symptoms. He's been lying and cheating, and now it's coming back to bite him.
The only problem with that theory is it's based on the assumption that the universe is a just place. If it were, then his poor manager wouldn't have been fired for no reason.
Lambert Eaton.
His chest was clear.
So we run an electromyography test.
You're still not explaining the PRCA.
What's his red count now?
I had to give him a blood transfusion. He's back around 30.
He needed a transfusion?
Well, he was losing blood, so I thought maybe he needed blood.
Go forth and scan his neck.
His neck?
Or repeat everything I say in question form.
You found a thymoma.
How'd you know to look in his neck? Thymomas usually present in the chest.
I knew it wasn't in his chest. All we've done since he checked in is look at his chest.
All the more reason not
There
to
are two
think.
types of PRCA. Acute comes on suddenly, chronic takes its time. We all thought Jeff's was acute because it happened right in front of us. What if it had been there for months, maybe years?
There's no way. It would have kept him from racing. With that kind of anemia, he would have needed constant...
Blood transfusions.
Which he was getting in convenient blood doping form.
He was treating himself without even knowing it.
Up to half of patients with chronic PRCA have a thymoma. And up to half of patients with a thymoma, I've always wanted to do this.
I'm not getting any better. Does that mean
You are healed. Rise and walk.
Are you insane?
In the Bible, just say, yes, Lord, and then start right in on the praising.
First you tell me I've got cancer. And then you tell me that my manager... What did you do?
No, what did you do, Lord? Thymoma is a tumor on the thymus gland. He's a bit of a wimp, but he hangs with tough guys. PRCA and an autoimmune disease called myasthenia gravis. MG causes muscle fatigue, including respiratory problems and difficulty swallowing.
And it can hit you that fast?
Treatment for PRCA is blood transfusions. The treatment for MG is hyperbaria. You were doing both as part of your regular freak show. You took a break, everything went to hell, which is not an uncommon reaction to Jersey.
So, the whole thing with my manager...
Oops. No. No EPO. This has nothing to do with anything you did. You can let her know she's in the clear.
I could. Or 10% of an IG contract is a hell of a lot of cash.
You don't need your thymus. We take it out, everything else is manageable.
Manageable. I thought you just cured me.
This is just diagnostic. Tensolano raises the symptoms of NG for 5 or 6 minutes. Sometimes less. This is exactly why I created nurses. There are 20 words to describe chest pain. Burning, squeezing, stabbing, tearing. Each one diagnostically useful. For that, you have to thank Dr. Powell's textbook. But there are no words to describe degrees of what he's feeling right now. Shortness of breath. If he had worked on those issues, there would be. So he never would have given up until he had an answer.
This isn't working.
Dr. House.
Please don't get up. I'm sure you're very busy. So I'm just gonna try and speed things up a little.
Is that epi? That's not the protocol.
No, the protocol is what you tried to do and failed each time. Over 100. Now we're getting somewhere. How's it look, Foreman?
No EKG changes.
Push harder.
House, you're gonna kill him.
No, he's right. Let him do it.
See? That's why he doesn't have to wear knee socks.
He can't breathe.
130. Our magic number. Nothing here. Foreman?
Still no sign of blockages.
Which means it's not the heart. So it must be the lungs. See? Was it so hard, was it?
No, just give me the rest of the epinephrine.
Test is over. It's okay. We're gonna stabilize you.
No. No, just let me die.
You're not gonna die.
Yes, I am.
We'll find a treatment.
I don't want to live like this. Please, I'm begging you. Kill me.
What happened?
I don't know. Must have fallen out of bed and got the nasal cannula wrapped around his neck somehow.
Ezra, what are you doing?
I don't want to live hooked to machines. Too weak to wipe my own ass.
Why would you want to wipe your own ass when you could have someone do it for you?
You're wasting your time. There must be other patients you could actually help.
Well, all services rendered on a first-come, first-served basis.
I won't consent to any more tests. And if anyone tries to so much as touch me, I'll press charges for assault.
Okay, well, you heard the man. He wants everyone to leave him alone. Why don't you go first? Get out! You came to me. I didn't come to you.
Figured you'd have the guts to do what had to be done if it came to that.
We're nowhere near that. It's time to test your lungs. Breathe. You're gonna have to exhale sometime. Stop.
House, you're hurting him.
You're hurting me. Fine. You don't help us, we don't help you. Your lungs slowly fill with fluid. You gasp to catch every breath, but never can. Every breath is petrifying. It'll be slow, painful, torturous.
We don't choose our birth, and we don't choose our death.
What if you could? How about we make a deal? Give me one more day. If I don't find out exactly what's wrong with you by then, I'll help you die.
House.
24 hours. Come on, it's not gonna kill you.
Huh.
Wow. You guys look like crap. What do you got?
Purple dye on my fingers.
What'd the bone marrow biopsy show?
Don't have the results.
What? What have you been doing all night?
Jello shots and wild sex. What else?
There's no bacteria in the blood cultures. We still have some cooking, but so far, nothing.
Nothing in the urine.
I was cleaning up to do surgery in because, well, they do. There was no sign of viruses or fleas on any of the rats.
Yeah. Who? Well, tell her to call a clinic. Then tell her to leave a message and I'll get back to her. Then tell her to leave a personal message.
Who's that?
Your protege. What are these?
Dictation tapes. He records everything.
Why?
Because he's a diligent researcher?
Or he's losing his memory.
A lot of people dictate their notes.
Yes, we could assume that and we'd have nothing. Or we could assume it's a symptom, in which case whatever's in his lungs is also in his brain. Unless you got something more promising.
I'll go get an MRI of his head.
Everybody who can walk should get out of here.
You can't do that.
Can't do what? Administer a prescription painkiller to a patient who's in pain? Go. Make sure somebody sees you downstairs in the cafeteria.
I can't let you do this.
Either I die in pain or I just die. That's what the argument is here.
No, it's about whether you die or we murder you.
What's gonna happen here is that someone's getting a buttload of morphine. I'm not sure exactly who at this point.
Can't be a part of this.
I always wondered exactly what was on the other side.
Nothing. What are you doing? Getting a laryngoscope. Don't just stand there. Help! But you told him that. It's something I like to call a lie. Bad, I know, but it's way further down the list than murder. He's unconscious. No more whining. Keep testing him. Go get a ventilator. I'm gonna do this all night.
It's not Kawasaki's either. What's next?
Congo Red.
Amyloidosis?
What the hell else would I mean by Congo Red?
It's not on the list.
There's no reason for it to be on the list.
An abnormal protein is building up inside the cells of his body, shutting down his organs one by one. Explains everything. The infiltrates on the x-ray, bone marrow, kidney failure.
We rejected amyloidosis because it didn't fit the first symptom we found. It would affect his heart.
It did.
It wasn't on the stress test.
We didn't push him hard enough. Add the stain. Let's find out.
Congo Red added.
Change the polarization of the light already.
That means it should be treatable.
How the hell you pull that out of?
Not out of mine. I had a muse.
Oh, God. Protein type AA.
Dr. House.
You have amyloidosis. It's in your lungs, kidneys, bone marrow, and brain.
Why should I believe you now?
If I was lying, I wouldn't tell you the subtype is AA. It's terminal.
Congratulations. Got your answer.
Baby, I'm sorry.
Me too. I'm so woozy I can hardly think.
We'll hang out at home.
No, you should go. Did you just feel something?
Feel? Like what?
Is there an earthquake?
In New Jersey?
Oh, God.
What?
I think I'm, like, hallucinating. Oh, 911.
I'm Dr. Cuddy. If you can hear what I'm saying, blink once. You can't talk right now. You have a tube down your throat, and try not to move your head. You've been in a terrible accident, but it looks like you will have no permanent injuries. You've had a bad fever, but it's gone now.
I've been here the whole time, honey, okay? I'm not leaving.
This is very important. I need you to blink one for yes, twice for no. Were you seeing a psychiatrist? Were you on MAO inhibitors? The antidepressant?
Megan, it's okay. It doesn't matter, okay? I love you.
Honey? Honey, what's wrong?
Megan, are you all right?
What's happening? Are we upsetting her?
Heart is beating too fast. Get the family out of here.
Megan? Megan!
Charging to 200.
Meg.
Clear.
Huh. You didn't write anything. So what you're saying is you didn't find that one big explanation, because there isn't one. Clever.
Well, let's just say your antidepressant theory does explain the fever. What about the heart? And don't say a building fell on her.
Okay. A structure collapsed.
Shut up.
Come on, it fits. Crushed musculature releases potassium, causes the VTAC.
You think she'd get crushed syndrome after she was crushed, not 2 days later.
Microvascular occlusions. Takes that long for the blood to reperfuse.
She'd have a baggy heart. Echo it to confirm.
Is crush syndrome good or bad?
Does it sound good?
I mean, compared to the other things it could be.
There are no other things it could be.
Then why are you testing her?
Excellent question.
What is it?
The heart's fine.
Why is she sweating? Her fever's back.
Why would her fever be back?
I can't say.
You don't know?
I know, I just can't say. Because you'll hit me. Let's discuss this in front of witnesses.
The DTs?
So she's an alcoholic now?
Her first fever was from the medication for her depression.
Or you're wrong.
Second fever was from the self-medication for depression.
This is insane. You don't think I would have noticed her being constantly drunk?
You're practically living with Sylvia Plath. You didn't notice that.
Tone it down or I will hit you.
Fine, I'll do liver enzyme tests.
Liver enzymes can also be elevated from musculoskeletal trauma. They'd be there whether she had a drinking problem or not.
They don't know that. Just pretend to confirm.
What's the treatment?
She's not an alcoholic.
Hair of the dog. IV alcohol. Tapered off after a few days.
She's sick and traumatized and half dead. You want to make her drunk?
Just do it.
You can't do this. We lived together. We were going to have kids. You barely even know her.
Apparently, neither did you.
The alcohol didn't cause the pancreatitis. The internal bleeding did. The question is, what caused the internal bleeding? I hate myself.
You do know that the patient had a building gland on her.
4 days ago.
Bleeding could start at any time.
He's bleeding from 5 different sites. Do you think they synchronized their watches?
She got warfarin after hip surgery. It's designed to mess with bleeding patterns.
Fever, heart, and bleeding. 3 problems, 3 completely different explanations. She must be the unluckiest woman in the world.
Only cling to this crazy theory because it's been proven right every step of the way. Each treatment worked.
Yes, she looks perfectly healthy. This much bleeding is a symptom of something more. And you need a team because you're wrong and you're gonna kill this woman.
Scraping in the uterus indicates that she had an abortion and nothing in her medical history. Only one reason to hide an abortion. Boyfriend wants babies, she doesn't.
She's bleeding everywhere unless the guy was performing an abortion with a shotgun.
Stop enabling him.
It's not the abortion, it's what she did after. Boyfriend would have noticed condoms. He would notice abstinence. He would not notice the pill. Which means I don't need a team. Hey, where's your mother in common law?
Dr. House, this is Doug McMurtry. His girlfriend was working with Megan when...
She's dead?
She passed this morning.
Well, then why are you still here? I need the old lady's consent to do some treatment.
What'd you find out?
I wish I could tell you, but since you're not legally related.
What the hell did you find out?
Your girlfriend had an abortion. See why I didn't tell you? I'd be insane to also tell you that she's on the pill.
No, she's not.
If they'd known she was on it, they wouldn't have given her blood thinner after her hip surgery. Combination caused the bleeding. It's good news. It's treatable. Just give her tamoxifen. It's just normally a breast cancer.
That's not true. 'Cause, we want to have kids.
She had already did the blood tests. And either she lied to you or her blood lied to us.
Tell Megan I'm glad she's gonna be okay.
What are you giving Megan?
Megan? Nothing.
Nothing? What's going on? What's wrong with her?
Her? Nothing.
Then why are you giving her drugs?
Just some amphetamines to wake her up. Everything could be explained by her lying to you. The antidepressants, the drinking, the pill. Until now. Now she's allergic to something the chart says she's not allergic to. That's not her lying, that's the chart lying. It just doesn't make sense. Do you know Liz Masters?
No.
Yeah, she worked with Megan. That was her boyfriend you met outside the morgue.
This is her chart. She's on MAO inhibitors for depression. She's on the pill. She had an abortion a month ago. And she's allergic to cephalosporin.
What's going on? What are you saying? This isn't Megan?
Yes.
Ben.
Since when?
Since right before I began pretending I loved it.
She's the same size as Megan, same build, same hair color. They were both horribly injured, unrecognizable. EMT teams do not second-guess family members' identifications at accident scenes.
No. Liz died yesterday. This isn't Liz. I know Megan. I know her hair. I know her hands. I know her smell.
What's her name?
Oh, God!
Your girlfriend never lied to you.
MRI shows no sign of clots. fMRI shows no problem areas.
They'll restart her IV.
What's wrong with it?
Nothing. But like so many procedures we put patients through, it hurts. But if she's enjoying it, it will show up in pretty colors.
This is why you wanted an fMRI?
It showed she didn't have a blood clot, which is diagnostically relevant. And it can show that she's become a masochist, also diagnostically relevant. And it'll be cool. Either explain which part of my analysis that makes sense, or go do it.
It isn't cool.
Sorry. Heavens. Look at her limbic system. Pleasure centers lighting up like a Hanukkah bush. Foreman must have a touch like an elephant.
K-Raz, we've got what we need.
Yes, it was impressive.
Roz, you all right?
Sorry, I was praying.
All through the procedure?
No, when Dr. Foreman apologized, I knew something bad was gonna happen.
She was praying. Could explain the brain activity.
BP and heart rate are dropping. She's crashing. She's stabilizing.
Get her up. All the way up, on her feet. Make her do that again.
That cortisol stuff is great. Does it work on everything?
I take it you're feeling better.
Still weak, but yeah. Oh, he must be so tired. Should go home and get some sleep.
I'll stay.
I never told you, but you are much better looking than Mrs. Silver led me to expect.
She never liked me. When I was 8, I threw up on her shoes at my uncle's wedding.
Your abdomen's a little swollen.
Is it serious?
It's hard to say. Sometimes it can mean a liver issue. We'll have to test.
Oh, dizziness is getting...
She's going to shock and need another liter of saline. Type and cross 2 units.
What's happening to her?
She's bleeding internally.
She's saying the Shema. She thinks she's dying.
The MRA shows you're bleeding internally, but not where it's coming from. The blood can only keep you stable for so long. Our best option is to open you up and search.
But you can fix it.
If we find the leak.
You find the bleeding, you find the disease?
No. But it could keep you alive long enough so Dr. House can find what's wrong with you.
Volvulus of the small intestine could cause bleeding.
She would have had constipation. Her value isn't beyond pearls either. Dead people have no value.
Polycythemia vera.
RBC count will be higher.
I need to bring the light to my face.
Thrombocytopenia. If it's autoimmune.
Titers were normal.
Parkinson's would explain the hypothermia.
Not the bloody urine. Woman's not just a masochist, she's a hypocrite. The commandment to preserve life comes before all others.
Actually means she's not a masochist. She's not following all the rules, just the ones that please her.
Right. She walked in crazy and explained how ritual trumps living, and you decide it's a beautiful lifestyle.
I know. She's wrong, but if there's nothing more...
Then the only meaning is here.
But if she thinks God is there for her, if she lives her life believing that God is there...
She dies. Things aren't where we want them to be just because we want them to be there. Of course, that doesn't mean they're where they should be. Hey! Stop that Jew! Chase hates working on Shabbos. I'm gonna make this easier for him. Stand her up.
She doesn't do so well on her feet.
Neither do I. Stand her up. You can tell all the ladies at the mikvah about this.
What did you do?
What are you doing?
Put your hand here. Press hard. You have nephroptosis, also known as floating kidney. The kidney is like a chandelier. It's attached to a ceiling of intestines and blood vessels. But your contractor, I think you know who he is. He hung it with a cheap chain. It's been hanging sloppy for years. Finally, something shook it loose. After that, every time you stood, your kidney dropped a few centimeters. Caused all your symptoms.
None of the scans picked it up.
Because we do scans with patients lying down. She's been lying down in surgery, too. We'd never have found it. Good chance she'd never come out.
She'll be all right?
Ultrasound to confirm, and tell Chase to put the kidney back on the shelf. The bleed will be nearby.
That's it.
Muzzle tov. Couple hours surgery, you'll be ready to push out those 14 children. You take the gloater to the patient's drug den. Make sure you pat down his pockets before you leave. You and Big Love biopsy a blood vessel from around the heart, test for polyarteritis nodosa. You in my office.
Those aren't my panties.
I know. Hypothetical. A young woman does something clumsy in public. And instead of laughing it off, she gets irrationally upset. Explain.
Maybe she's clumsy because she's nervous because she forgot to do her spelling homework. In my hypothetical, she's 8.
But this girl is not insecure. Seems more like she's afraid.
Do you have a point, or did you just get a new book of riddles?
I think you're hiding a medical condition.
I'm not. I'm glad we had this talk.
Doctors often try to ignore their symptoms because they think they can't get sick. If you've got something going on, I need you to take care of it.
And I take your compassion entirely at face value.
It's not compassion. Self-interest. I want my team
It's
healthy.
not self-interest, it's curiosity. I dropped a file, House. I start bleeding from the eyes, I'll be sure to make an appointment.
Okay.
Those really were her panties?
Cole has traveled through the forest of crustaceans and brought us a treasure. He has earned his reward.
If I could just get the immunity, I would...
No, Sophie, you can't. Use whatever criteria you want.
Could be a clotting issue.
If he developed DIC after the surgery, even a normal biopsy bleeds out of control.
So, cardiac arrest and DIC. What's the common denominator?
Could be cancer.
We've been looking in his chest since he got here. It's clean.
So the main mass is somewhere else. Throws up a clot, blocks an artery in his heart, causes the arrest.
Good. Go find out where he's hiding his cancer. I have a new theory. You're not stubborn. You're not getting it checked because you already know the answer. Found an old picture in your wallet.
Of course you did.
I wasn't snooping. I needed lunch money. Figure it's your mom, except she looks about 32 years old. Well, the only reason not to update a photo in 20-odd years is she's not talking to you, which would be interesting. Or she's dead, which should also be interesting. She's dead.
So's Grover Cleveland.
Pretty young to have a dead mom. Even younger, 20 years ago. I Googled her obituary. Said she died at New Haven Presbyterian after a long illness. Parkinson's?
Huntington's chorea.
I'm sorry.
I'm leaving when this case is over.
No, you're not.
You don't want a doctor on your team who's slowly losing control of her body and mind.
Huntington's isn't the only thing that causes tremors.
You think it's just a coincidence?
I think you're the only one on the team who drinks decaf. I've been switching it out with regular ever since you dropped that vial. You're trembling because you're hopped up on caffeine. First vial was my fault. Medical explanation for that is people drop things.
I've been walking around thinking I'm dying.
You are.
You don't know that.
With Huntington's, it's inevitable.
No, you don't know because I don't know.
How could you not get tested? If your mom had it, it's 50% chance you're a bomb waiting to explode.
Not knowing makes me do things I think I'm scared to do. Take flying lessons, climb Kilimanjaro. Work for you.
Yeah, 'cause if you knew, you couldn't do any of those things. What?
You're sweating. You're burning up. House. You're sick.
Could be pneumococcus. That'd cause chest pain and a stiff neck.
It's not pneumococcus.
Let me check your lymph nodes.
I'm not the patient. The patient is the one whose body is shutting down. I'm having a benign transfusion reaction.
Pseudomonas would present as an armpit rash. Take off your shirt.
You first.
House, you gotta let us do this. We can't biopsy him without bleeding him to death.
You are not biopsying me.
How's your stomach? Any diarrhea?
The more transfusions you have, the greater the chance of you reacting. I've had 3 in a decade. Fever will be gone in a couple hours.
I heard somewhere that doctors ignore symptoms because they think they can't get sick.
You told us to give you the blood so that you wouldn't...
I am not sick.
Fever is a symptom.
But not of what the patient has. My kidneys are working. I'm not bleeding out of every organ.
Yet.
This is a waste of time. And it's distracting you from the actual case.
What's wrong?
I'm spitting.
You okay?
I'm dizzy. My mouth just went dry.
Could be a symptom of any number
Symptom of narcotics. Who's spiking?
What'd you drug him with?
Amber's nickname is Cutthroat Bitch, and you're pointing at me. Got the kidney sample?
You're the only one with nothing to lose.
Could have been you. You don't seem to care if you get this job or not.
Yeah, I've been here for 8 weeks because my subscription to Masochism Weekly ran out.
You're the only one who hasn't asked me not to put him on the block.
You're either gonna pick me or you're not. You're fair enough to try to make the right decision, and arrogant enough that nothing I can say will change your mind. I don't want it to be over, but unless worrying about it is gonna make a difference.
I'm gonna run some stains. He'll be less of an ass to you.
Patient dead yet?
No.
It's a little much for a first date.
Obviously, you've never dated me.
Feels like you already got the lung and kidney samples.
Now I just need a piece of your liver.
Yeah, you might want to use a little bit of lidocaine.
Oh, yeah, I forgot.
Oh!
Slight pinch.
You drugged me.
You drugged me? What the hell is this?
Looks like an envelope with the results of the genetic test for Huntington's inside.
Did you look?
I thought it'd be fun to find out together.
I don't want to know.
No, you're afraid to know.
I might die. So could you. You could get hit by a bus tomorrow. The only difference is you don't have to know about it today, so why should I?
I don't have to know the lottery numbers, but if someone offered them to me, I'd take them.
You spend your whole life looking for answers. Because you think the next answer will change something, maybe make you a little less miserable. And you know that when you run out of questions, you don't just run out of answers. You run out of hope. You glad you know that?